We so far have randomized about 650 patients in the TAXIS trial. The patients are randomized into, these are all clinically node-positive breast cancer patients. They're randomized into axillary dissection versus axillary radiation. And after the first 500, we pre-specified several sub-projects. And the first one is looking at trends in use of neoadjuvant systemic therapy. In the TAXIS trial, all patients that have an indication for axillary dissection are included in the adjuvant and neoadjuvant setting, and we do encourage inclusion of all consecutive patients so we can actually study trends in use of neoadjuvant systemic therapy. And the major finding was that there is huge variation by country and by institution, ranging from 10 to 50% of neoadjuvant systemic therapy rates in patients with ER-positive, HER2-negative breast cancer. So there is a lot of need for standardizing indications for neoadjuvant systemic therapy across Europe. That's the major finding of this study.